Okay, so the next question. Is there any specific topic or policy that you would like to see implemented that would influence healthcare that you would be in favor of? If so, do you see that happening in the near future or ever? What can you do on a personal level to work towards that change?
Right away off the bat, I'm sure we can all agree about establishing a national, safe patient to nurse ratios. Some states are doing this, such as California, where they have a set nurse to patient ratio. However, others need to follow suit. And best way to kind of tackle this would be to start at our state government level, where we talk to the government and incorporate these other nurse supporting groups, like the Board of Nursing.
That's exactly what I had in mind. What Bailey was going for was those safe nurse to patient ratios. Staffing is so important, and us travelers kind of fill that niche, but it's only a temporary solution. And we're always going to be there, but it's never going to really help the permanent staff at these hospitals. Uh, and I'm working in California right now, and I love it. It's so much, it's just lovely. Um, that we have those better ratios, as well as we have break nurses. Anybody know what a break nurse is? I didn't until I came out to California. It was really
That
great
sounds
to have.
lovely.
Yeah, it's awesome. Um, so to go on to personally, I feel like it's hard as a traveler to try to implement things more strongly, but the core staff nurses, some of them have unions that they're in. They're, working on that ground level at their specific facility to try to institute better safety for themselves as well as their patients. The state level is great, the national level even. I'm part of a Facebook group that's the Nurses March, National Nurses March, that they have every year now annually, where they go to DC and they try to, stand up for these important issues for nurses, like safe ratios and um, all those things.
Oh, that's awesome. Maybe
Yeah.
I should do that.
Yeah, it's an interesting page. People post different articles and things too that just bring you attention to what's going on in nursing and healthcare. So,
Yeah, that's awesome.
I forgot a big part of my introduction, which is that about 2 years ago, I got very involved with the Ohio Nurses Association and specifically the Summit and Portage District, to the point that I actually became the executive director. So that's been a very nice complement to having a bedside practice, to see healthcare at like a macro level, a policy, institutional level, rather than just the one-to-one care. So I did want to take this opportunity to talk about House Bill 285, and I took notes. It is in the House committee. It's sponsored by Representatives Gambari and Rogers. They came to the Ohio Nurse Association convention, so I'm very grateful to them that they could be there and they could sponsor this legislation. It's literally called Require Hospitals to Establish Registered Nurse Staffing Plans. So please, anyone who's watching and lives in Ohio, especially if you're a nurse or considering a future in nursing, this will directly affect you. Consider researching who your representatives are and reaching out to them about this legislation. Because I can only imagine how wonderful it is to have set staffing ratios. And that was actually a question I wanted to ask you two travelers, like if you've experienced that and what it was like, which Hannah already answered.
yeah. Good. It's good stuff.
Yeah. What about you, Bailey? Have you been in a state that has legislation for staffing?
Not yet. I also did the majority of my traveling during the heaviest parts of COVID. So now that we're out of the worst of it, I hopefully we'll get back out that way. I'm currently in Vermont and we don't have any legislation at this time out here. However, knock on wood, it's not too bad. Now we're coming into virus
Yeah.
season, so that might
Yeah.
change. I've been very fortunate thus far, but I look forward to hopefully getting back out to California where there are stricter rules on that.
I haven't gone to this event myself, but Ohio Nurses Association does Nurses Day at the State House. It's called N-Dash. I think it's in the spring. That might be something for everyone to keep on their radar. They do have a student membership. I believe it's at a reduced rate. Forgive me if I'm wrong. So yes, as far as legislation, that was just something I wanted to bring up. And then I also, admittedly, I didn't read into this too much, but I know there was some talk about like capping the pay for travel nurses. So if I
Yeah.
may ask you too another question, I was wondering if that affected you and also what you think of it.
I'll start. There was definitely talk about that, and that's what one of the major points was when they started the Nurses March, the National March in Washington, D.C., big topic.
Mhm.
And my take on it is, the travel nurses were making great rates during COVID because of how short the staffing was and how burnt out and how everything was going on. And that was a very short period of time. It might have felt like it went on forever, but it was a short period of time. Rates fluctuate with need. Healthcare is still a business, unfortunately, and that's how it works. And the fact that these CEOs who make billions of dollars in their hospital are going to cap our nurses' pay who make pennies compared to their
Mhm.
big dollars is, in my mind, crazy. Like, let us
Mhm.
have our dollar when, when it's available. Like, let us go for it. Why not? If it's
Mhm.
needed to cap our pay, no.
Mhm.
I fully agree with that.
Yeah.
Yeah, I always thought that was crazy too because you take like a lot of risks being a travel nurse. You don't get benefits like directly from your employer. You like obviously have to be on the move and so you have a lot of like instability with life a little bit. So I think like the excess pay is definitely warranted.
I also thought it was crazy because I've never heard of any other profession having a cap on their salary. So why is nursing being identified as a field that would be an appropriate thing to do? Lana, could you remind me what the original question was? I kind of got excited about the 285 thing.
I think we all like answered it, but is there any specific topic or policy that you would like to see implemented
Oh,
influence the healthcare field? And then
oh,
if like what would you do on a personal level? And do you ever see that happening in the future or ever?
if I could also just take a moment to talk about workplace violence and legislation to prevent workplace violence against healthcare workers. So, my state representative, Casey Weinstein for District 37, he's working on some legislation about workplace violence in hospitals. And our group gave him the Nursing Support Award for that. So, that is one way that I've tried to influence legislation in my area. And I'm also, we started a workplace violence prevention committee at my work, and I helped do the literature search. And again, I just want to get that idea out there for anyone who's listening to um, know that you should not be subject to violence at work. You need to do an incident report. Please know that I mean, in my experience, there are no ramifications to that. That's how they keep their data. That's how they decide, oh, maybe we'll give this unit an extra nurse today because we've had these incidents of workplace violence. um, if no one's doing the reports, we don't have the data to make change. And we need to make change to make nursing a safer profession.
Yeah. I mean, I've definitely witnessed um workplace violence and so and I've also witnessed people be like, "Oh no, it's fine." But no, you're right because
Yes.
don't if you don't report it, then the one time it gets reported, the response will be, "Oh, well, this is a one-time occurrence."
Yes.
That
This is
this
the change we need, like a cultural change we need to make in nursing.
right, exactly. So I love that you mentioned like what you could do on a personal level because it's true. You can support the people that are in the level of making change. So you can support them in the ways that we can, and there's definitely ways that we could do that on a personal level.
Mhm.
So thank you for adding that. And I'll definitely look into um the bill that you mentioned and look into